Hello, my name is Dr. Dave Rearick. I'm a retired family physician, father of 4, and a grandfather of 9. When I was in clinical practice, I took my call in pediatrics. So I have lived through the years before vaccines and during their development. I've seen the devastating complications from these preventable diseases, and I want everyone to know the suffering that can occur to the unvaccinated. I was only 6 when the oral polio vaccine came out, and as a child, we lined up and obediently took our sugar cubes to prevent this polio disease. In 1950, there were over 1,200 kids living in an iron lung 24 hours a day, 7 days a week, because their respiratory muscles had been paralyzed by polio. Of course, the most common complication was paralysis of the lower limbs, the legs. And these kids, which were in my school, had to live with their braces, their crutches, or in a wheelchair for the rest of their life. Why would you even consider not preventing this kind of an illness in a child? I was in high school when the measles and mumps vaccine was developed. Prior to this vaccine, there were multiple kids that suffered with pneumonia, encephalitis, diarrhea, dehydration, and hearing loss. And mumps can cause infertility. Try to explain to your son or daughter why they're infertile because you refuse to get them vaccinated. It wasn't until I was in college that the rubella vaccine became available, commonly referred to as German measles. German measles can cause deafness, cataracts, heart disease, blindness, and intellectual disabilities. Who wants a deaf, blind, dumb kid, particularly when it's preventable? It wasn't until I was in college in 1974 that the MMR vaccine became available. And I was in medical school when the meningitis vaccine was developed. Initially, meningitis vaccine was only indicated for adolescents, young adults, and military recruits who lived together in close quarters in barracks. But meningitis is probably the most serious disease that is preventable. Meningitis is an infection of the brain and spinal cord. It's serious. It causes septic shock, stroke, and 15% of people die. Why wouldn't you protect yourself and your children with a meningitis vaccine? I've seen some of these complications, and they're all preventable. Please listen to the American Academy of Pediatrics, the Infectious Disease Council of America, the American Academy of Family Physicians, who all recommend the old vaccine schedule that is now not necessarily recommended by some. Vaccination doesn't only protect the vaccinated, it protects also your friends, your neighbors, your community. People with a compromised immune system, those with cancer, those with multiple chronic diseases, can't fight off disease very well. And even if they're vaccinated, they could still catch some of these conditions. You do not want these diseases circulating in your community and putting these people at risk. We need to maintain our herd immunity. If you have a story that you'd like to tell, please join us at Grandparents for Vaccines. You can go to our website at grandparentsforvaccine.com. Thank you.